I've been practicing in Maldives since the last 2 years. I come to Maldives clinic. So I've seen a lot of diabetic patients in Maldives. And we do get very excellent care in Maldives, and the doctors, we have got very excellent doctors and very good big institutions. So it would be wonderful to hear about diabetes incidents and about diabetes in general in Maldives, and probably with a perspective from India also, because we have a similar diet and profile. So over to Dr.Ali Siyan. We love to hear him speak.
Good morning, ladies and gentlemen. First of all, I would like to thank Dr. Jyoti and organizers for giving me an opportunity, specifically Diabetes Society of Maldives and Maldives itself, to actually speak and represent our country and the situation of diabetes and NCDs as a whole in the country. I have to say it's a sharp contrast. My topic is in sharp contrast to what Sir just mentioned, the lecture just we heard, because rather than focusing on diagnosis and management itself, Maldives is at a stage where we needed to understand the state of diabetes in Maldives, where we stand when it comes to risk factors, where we come in terms of our lifestyle, and why our lifestyle and our changes in our lifestyle is leading towards a high rise in diabetes and NCDs as a whole. So let me just give a little bit of brief explanation about where Maldives is. First of all, we are actually very close to Maldives right now. We're just below Trivandrum and India itself. As you can see, Maldives is a small country with a geography which is unique. And this presents us with both advantages and disadvantages. We have a very small population of about 350,000, and we are mostly known for our resorts, our beaches, our beautiful landscape. But then again, this is not what the rural Maldives look like, or where Maldivians usually spend their lives. There is a rural Maldives where the island lifestyle is, in fact, very laid back. And we have drastic changes in our lifestyle which had led to many increase in risk factors, as I would mention later on in my talk. Now, it is important to notice that apart from the rural areas, there is one piece of land which is probably the most densely populated piece of land in the entire world, the capital Male, in which almost 200,000 people live in about 8 square miles. Now, this leads to challenges in itself, with congestion, with very sedentary lifestyle, changes in our economy, changes in our food and dietary habits. We're talking about a very young population, about 35% youth, a geography consisting about 90% of water, and majority of our diet consists of mainly seafood, specifically just fish. But fortunately, we have a high literacy rate. Now, when it comes to a geography like Maldives, we are faced with a very unique challenge of logistically reaching each and every island in the country. We are made of 1,100 islands and about 200 inhabited islands, for which we have to have small health centers in each and every island. We have to focus on atoll hospitals. We actually cater for these centers, and regional hospitals for certain regions, and only 2 tertiary hospitals which has major laboratories and facilities, which itself is limited. Now, of course, the Ministry of Health is the hierarchy and the main policy maker and regulator in the country, and the regional hospitals who have limited facilities cater for the regions and the health centers in each and every island. When it comes specifically to treatment of diabetes and facilities for the diabetes treatment in the country, many of the islands does have the facility to check blood sugars, usually with just a glucometer, without laboratory investigations. The regional hospital does have limited laboratory facilities for which certain diabetic complications can be screened for. And it does not, the Maldivian community does not have all the range of medical treatments that we usually, or in India or other parts of the country, are used to. For example, for us, the only available insulin that are available is Mixtards and Acrapid or regular insulin. So a multiple dose regimen, which we all hear about so often nowadays, about the preferred method of treatment specifically for the type 1 diabetes, is not available in the country, and it is only the Diabetes Society of Maldives, under funding from Save a Diabetes Child program of IDF, from which we get the insulin, and we are able to provide insulins for the diabetics, type 1 diabetics, but which is probably not a very sustainable way to go for. Now, from an economic point of view, I'm very pleased to say that there is a social insurance scheme which provides free healthcare services for all the patients, as long as these treatments and medications are available locally in the country most of the time. So there are challenges in itself. Therefore, we noticed, Diabetes Society made it a point that we had to focus on the rural areas and the most isolated regions of the country. For that, we needed to have a plan. Diabetes Society realized that we needed to have a diabetes educator in each and every inhabited island of the country, so that they can actually work in the field face to face with the population and individuals of the community, give them the necessary the information on a daily basis, conduct screening programs, and intervene the risk factors that are associated in that community. We couldn't entirely focus on just the capital city and the health facilities that were available only in the capital or the urban areas, as we refer to. Now, the 200 Island project, which I mentioned just now, was in association with specialists, especially from India. We had so many distinguished guests and lecturers who visited us. We all sat together and we built a curriculum that would actually cater the needs and the educational knowledge of these educators who were recruited from the existing health facility of these inhabited islands, so that they had a better understanding of what knowledge and what information would be needed for them. Now, the results were very positive. We were able to conduct screening programs throughout the country. We were able to detect a lot of diabetic patients who were pre-diabetic. As we all know, the importance of detecting diabetes and impaired glucose tolerance at different stages of diabetes as early as possible. Now, we were able to screen about 27,122 patients specifically. This is just till 2013, and it's still ongoing. This is one of the, as you can see, the screening programs itself was a challenge. Logistically, the team had to travel from island to island to conduct these studies in association with the diabetes educators existing in the neighboring islands. We realized that it was important for us to know the basis of diabetes and the situation of diabetes in the country, in order to plan our future, in order to know where we need to intervene. We developed a risk score, and we found out there were significant differences in the risk score of type 2 diabetes according to the geographical distribution of the country. We realized that it goes same with high blood pressure and high cholesterol and heart diseases as well. So therefore, we were able to identify the regions where we needed to focus on. We were able to identify the risk factors as well. For example, the dietary habits. What were they eating? What were the differences in Japan? Now, it was surprising that we come from basically the same culture. We have the same kind of food that is available. We are of the same religion. and we have the same traditions as throughout the country, throughout different islands. But we found out that there were significant changes in their dietary habits, which was kind of surprising. Of course, exercise was not something Maldivians were very familiar with as a regular activity, and smoking was surprisingly very high, especially in the rural areas, which goes with same fruits and vegetable consumption. Part of the problem was people were not aware that locally grown vegetables, which were very different from what we see as vegetables and fruits and vegetables in this part of the world. I'm not talking very far from Maldives, but even in India, because Maldives is not a very agricultural country. We are more known for our fishing. So people were not familiar with the tropical fruits that could actually be healthy and that could actually be used and considered as healthy fruits, and vegetables which were locally grown. There was the culture of only considering carrots, cabbages, lettuces as vegetables, and apples and oranges as fruits. So we had to start at the grassroots level to make people understand what fruits and vegetables were and what a good, nutritious, balanced diet was. Now, the same goes with the diabetes and the dietary habits, heart diseases, high cholesterol. Now, I'll just skip through these and focus on one specific fact that we realize that as a general rule, Maldivians did not have a habit of regularly exercising. And those of us who did exercise were only exercising after a diagnosis of an NCD, either diabetes, heart disease, high cholesterol, or any other morbidities that were associated. Only after the repeated consultation with doctors, or when they actually had a disease they were afraid of. Even then, we found out that it's only less than 35% of diabetic patients and who actually exercise regularly. It was only less than 30% of high cholesterol or blood pressure patients who were exercising on a regular basis. We realized that BMI was a huge issue in the country. The high waist circumference was directly related to the heart diseases, type 2 diabetic patients, and high blood pressure patients. As you can see, high BMI and waist circumference was significantly high seen in people who were diagnosed with high blood pressure, diabetes, and other NCDs. One thing to be noted is it was the females who had higher BMI than males. Now, we all know women's health or non-communicable diseases associated with women probably would have a bigger impact, a bigger negative impact on the society as a whole than males. So this was a significant find. In conclusion, we can see that it is not so different from what we would see in a South Asian country. Type 2 diabetes prevalence was about 8.1%, and obesity with a BMI more than 30 was about 13.5%, and smoking was 22.7%. More significantly, people who had a high risk score for diabetes was more than 62.5%. Now, this is considered alarming because we're not talking about a very elderly population here. In fact, the participants of the study and the screening programs were in fact more than 70% was below 30, and 32.4% was in fact below 30 years of age. Now, this is a young generation that we're talking about, and with a significantly high risk score for developing NCDs, specifically diabetes. Now, what do we do about it? We mainly realized that we needed to create more awareness, specifically through community involvement and involving more media-related information and mass media. We can use mass media to actually create more awareness throughout the country. And one of the example is the human blue circle around an island. This is an event that we had in 2010, where a lot of individuals from the community, including all the NGOs and different parts of the field of activity, participated in creating a blue circle which was covered by the media. And the next was we walked in all the inhabited islands carrying slogans about diabetes, and we made the community participate in these walks. And this was conducted in 2012, where we were able to reach such a wide majority of our population. More recently, in 2013, which became a huge local event and was covered even internationally, was an underwater blue circle where 300 divers participated. So now these are media events which created a hype, which made people talk about diabetes, which was needed for a country like Maldives, and probably for any other country who wants to tackle diabetes for the future to challenge the rise. Now, what is the conclusion? We need to intervene at an early stage. Rather than diagnosis and treatment, which is very important, we need to go way back before the actual problem arises, because the risk score which we see are alarming. Now, we need better awareness programs for this. We need better medical facilities, specifically in different parts of the country, where the risk is higher than the urban areas, where the expertise are minimum. We were so glad to have the educators in the local islands. At least we had a way of knowing the situation. For that, we need international support. We need more planning, knowledge, and funding. Thank you very much for listening to me. I hope you have an idea from a different perspective about Maldives and diabetes situation in the country.
That was a really enlightening talk on Maldives and diabetes in general. Just to add 1 or 2 points from my experience in Maldives, because I've been visiting there for the last 2 years. One, it is a very highly literate country, and the medium of education is in English. So it will be very easy to have health awareness programs in Maldives because they are very easy, able to understand. The internet connection is quite fast and the broadband is there. Probably doctors from Maldives can be. I was just checking the conference online while sir was speaking. It is available online and people can view from Maldives and all over the world too. And one thing I found in Maldives is that people smoke a lot. Smoking is very rampant and people don't like us telling them to stop smoking. That is one thing we could probably concentrate on to bring down the incidence of diabetes and the lifestyle. And just one last point. You saw the photos of Maldives. It's really beautiful. And it's more beautiful if you go under the water, as in scuba diving or snorkeling. I think we have time for 2 or 3 questions because Dr. Joseph allotted 2 to 3 minutes for questions. So if anybody has a question on Maldives or...
Excellent presentation, and it's quite interesting to know about Maldives. And it's quite surprising to note that there's a lot of NCDs increasing in your country. In spite of fish being a major eatable thing which you're doing. In fact, fish has got a lot of omega-3 and it has got a protective effect in preventing many of the NCDs. So what do you think is the contributing factor to such an increasing alarming rise in the NCDs? Is it more sugar intake, or is it more carbohydrate intake, or is it less of physical activity which is causing this alarming increase?
I think it's something that as Diabetes Society, this is exactly the thing that we actually started to think and we wanted to figure out. But I think one of the aspects that we need to figure out is we need to understand is the change in lifestyle and the economic change and the difference in lifestyle came very suddenly in Maldives. Maldivians used to be fishermen who actually physically went out. They were very active in the field. They were actively working, physically working, and as we can say, sweating on a daily basis. But then the changes in Maldives, the globalization hit us, and it came to us in a rapid pace. Now, when I mentioned the rural areas, it is only the pace, the lifestyle pace which has changed. The food is urban, very fast food based. Everything is available. They are actually pretty well off. They don't have the knowledge about good dietary habits. In fact, they have a lot of fish available, and it is the main meal which I am saying, but of course they add a lot of carbs in it.
And one more thing, the use of rushi as food.
Exactly.
Maida mav is rampantly
Exactly.
used. All carbohydrates is like...
I think you must have heard of garudia, which is basically a fish soup, fish and water. The main dish consists of 90% rice, one piece of fish, and the soup. So that's it. So this has been our meal for a very long time. The leaves that are available, the vegetables that are available, usually is not eaten. Usually it is sent to the capital, Male, where people who actually are more accessing more of these dietary habits, are in the interest of exercising and diet, are consuming it. Now the challenge is to use this, to provide this information to the rural population, and even with the facilities and even with the food and resources available, we need to provide them more information about it. So I think it's a combination of both lack of physical activity and actually portion control and selecting the right diet as a whole.
No, I think I would have also thought of in the first go, I would have also thought that fish is icosapentaenoic acid and other things. But I think that is overruled by the increased smoking. So I think you lose the protection and the HDL comes down with smoking, and of course with lack of exercise also the HDL comes down. That is number one I want to tell you. The other one is being an island with all sea sand, I think you may be growing less of fruits and vegetables there. I have a feeling. The other thing is you are mentioning about more of females being, I would think that it may not be cost effective, but still it may be good to look at their vitamin D levels, because most of the women are in parda. We know that vitamin D can be get aggravated by deficiency, can aggravate the diabetes. So have you looked into those? I know your cost constraints.
Yes, in fact, it's actually something that we have noticed. And we are regularly checking vitamin D levels as well now. Recently, it is. Because like you said, it's only in the tertiary centers in which we are able to even do certain other investigations, which probably is a must for diabetic patients. So it is a challenge for us. Like I said, logistics is an important part for us. And it's a very costly reason because of the isolation among the islands. Vitamin D is something that we are looking into, but to a very, very limited population of diabetes. And with the result of this, we are able to focus on so many issues like what you have said, the issue of vitamin D, the issue of actually smoking, consumption of high sugary drinks like energy drinks. So these are several things that we have noticed. I've just highlighted certain things that we are focusing.
We had a very, we would be having a lot of doubts on this same topic. Luckily, we have friends from Maldives who are here, and we can discuss over lunch. So it has been extremely good. And next time, we hope we have a bigger contingent coming in from Maldives for the excellent CMS conducted by JDC.
Again,
thank you
very
much.
Yeah.